Hi, I'm Julie. I'm the physiotherapist working in the Healthy Living Centre in Cairns. The following presentation is aimed at people living with a spinal injury who have at least partial activity of the diaphragm. COVID-19 is a new and potentially deadly respiratory virus which affects the lungs and is particularly dangerous in those of you who already have a respiratory impairment. This is why it is especially important for you to avoid any unnecessary risks when it comes to activities that may include contact with people or surfaces that have been contaminated with the virus. The government message is stay at home, and this should happen as much as possible, though visits for healthcare is permitted. In this current era of isolation and fear of the COVID-19 virus, it is especially important that we look after ourselves. Those of you living with a spinal cord injury may have problems with being able to breathe deeply and to cough forcefully, dependent on the level and completeness of your injury. As you know, this makes you more likely to retain secretions and to not get enough oxygen into your lungs. This makes you more prone to chest infections, even without the complications of COVID-19. The government instructions are evolving daily in response to the new cases of COVID-19 being reported. At the time of writing this, we are being told to stay at home when possible, to have groups of no more than 2 people, to keep a safe distance from each other, to wash and sanitize our hands regularly, to cough or sneeze into a tissue and dispose of it immediately, or to cough or sneeze into your bended elbow. If you do develop symptoms, contact your GP. I know that most of you will be following a lifelong care plan to help prevent respiratory complications. In view of the current increased risk of infection with the COVID-19 virus, I thought it would be good to review some of the methods that can be used to increase your respiratory health. Maintain good posture when sitting, either in your chair or wheelchair. This is important for many reasons, including respiratory health and pressure injury prevention. Check your cushion and wheelchair support systems are still effective at keeping you in the best upright position. Contact an occupational therapist if you feel the need for further advice or help with your posture and seating. Sit out in your wheelchair every day to encourage cardiovascular exercise. When in bed, turn regularly to prevent the pooling of secretions. Try to do breathing exercises at least twice a day. People with spinal cord injuries have the greatest respiratory capacity when lying down, so the best time to do your breathing exercises and coughing would be in the morning and at night while you're still in bed, taking care not to breathe secretions or saliva back into your lungs. Any secretions that reach your mouth should be spit out. Start by repeating each exercise 3 to 5 times, stopping if you become dizzy or short of breath. You can increase or decrease this as you feel appropriate. People with a spinal cord injury who have full or partial use of the diaphragm should practice diaphragmatic breathing, sometimes called belly breathing. Breathe in through your nose and allow your belly to rise upwards. Breathe out through pursed lips, bringing your tummy down. If you place one hand on your chest and one hand on your stomach, the hand on the chest should not rise significantly. The breathing can be felt in the rise and fall of the stomach. Here are 3 more breathing exercises that can help increase the oxygen entering your lungs and reduce the buildup of secretions. If you have different breathing exercises that work for you, continue to use them. Take a deep breath and hold it for a few seconds before slowly breathing out. Repeat 3 to 5 times. Second exercise. Take a deep breath and hold it. Take another breath and hold it. And take one more breath before slowly breathing out. Again, repeat 3 to 5 times. Third exercise is take a deep breath in Then breathe out as long and fast as you can. Repeat this 3 to 5 times. If you have a spirometer, you can use it to both exercise and to keep a measurement of your progress. It is important to cough to remove any secretions in your lungs. Cough regularly, and it's best done in conjunction with your breathing exercises. If you are able to cough effectively, take a deep breath and cough 3 to 5 times. If you are unable to cough effectively, perform self-assisted coughs 3 to 5 times. If you have not been taught how to do this, or you can't remember, contact your physiotherapist. If you need someone else to perform manual assisted coughs, arrange to do this at least 3 to 5 times, twice a day. If you use a machine to help you cough, continue to use as prescribed. Remember to spit any secretions out of your mouth into a tissue or an appropriate container. Don't attempt to swallow them, as you risk aspirating by breathing them back into your lungs. If you wear an abdominal binder to help assist your intercostal and abdominal muscles, continue to do so. I recently had the great honour of being able to speak with Tim McCallum about the Singing Chords programme and their pilot research study. Tim is an international professional singer, the ambassador for the Hopkins Centre, lead researcher and singing instructor for Singing Chords. Tim sustained a C4-C5 injury at the age of 18. Tim told me about recent research into can peer-led group singing influence breathing, voice and quality of life. He said that they ran informal singing group sessions for 18 months every 1 to 2 months. They also ran a 3-month pilot research project with 5 inpatients and 5 outpatients. The results are not available yet, as the research is currently being collated, so there's no data available yet. But Tim said he is confident that the sessions made a significant impact. It could be seen in how the subject's projection improved. That means the ability to blow out air. They had a better coughing technique and a definite improvement in mood. Tim went on to say that singing and vocal training strengthens respiratory muscles, keeps the airways active and open, improves respiratory health, and of course is good for the soul. He also wanted to thank Spinal Life Australia for their support and sponsorship. Tim can be contacted on info@timmccallum.com.au if you want any more information about Singing Chords. Water is the best drink for you. If you feel thirsty, you are already dehydrated. Try to drink plenty of water throughout the day and avoid sugary drinks. Water helps to prevent secretions in the lungs from becoming thick and difficult to cough up. Secretions stuck in the lungs increase the risk of chest infections. Your body needs the correct balance of nutrients to operate at its best. If you are overweight or underweight, you're more likely to experience respiratory problems. So everybody needs to eat a healthy diet. The chemicals in cigarettes have been proven to reduce the amount of oxygen in your blood. Also to increase mucus in your lungs with a reduced capacity to cough it up. The chemicals also destroy healthy lung tissue, just like COVID-19. The chemicals also increase the possibility of pneumonia, bronchitis and emphysema, and increase the risk of lung or throat cancer. So the lesson is clear: don't smoke. With gyms being closed, it makes exercising more challenging than ever. However, everyone should continue to exercise for overall fitness, mental well-being and respiratory care. Cardiovascular exercise consists of any exercise which raises your heart rate and your breathing rate. If you're having difficulty in choosing an exercise program suitable to your needs, please contact your physiotherapist or exercise physiologist for advice. Spinal Life Australia is continuing to provide essential services. However, we are currently requesting visits by appointment only. If you need any assistance or require an appointment to see a physiotherapist, an occupational therapist, or an exercise physiologist, please contact us on 1300 774 625 or email us at enquiries@spinal.com.au.